Men are statistically less likely than women to see a doctor, even when something is wrong. But preventive care isn't just for when you're sick, it can literally save your life. Hi, I'm Dr. Stelina Gowdy at Gowdy Family Care Center, and in honor of Men's Health Month, I want to walk you through the key screening every man needs and when to get them. Even in your younger years, routine checkup matters. Here's what men in their 20s and 30s should be doing. Blood pressure screening, at least every 1 to 2 years. High blood pressure has no symptoms, but it significantly raises your risk of heart attack and stroke. Cholesterol check, starting at age 20, especially if you have a family history of heart disease. Blood glucose screening, and that would be to check for prediabetes or diabetes risk, especially if you're overweight or if you have a family history of diabetes. STI screening, or screening for sexually transmitted infection, that would be based on individual risk factors. Testicular self-exams, monthly, and that would be to catch any unusual lumps or any changes and making sure that we catch them early. And don't skip your annual physical. It's the foundation of everything else. As you move into your 40s and 50s, the screening lists expand. For example, colorectal cancer screening, which is recommended at the age of 45. A colonoscopy can detect polyps before they become cancer, which is why it's important to begin those screenings on time. Diabetes screening, more frequently if you're at high risk, if you have high risk factors like obesity, high blood pressure, or a sedentary lifestyle. Prostate cancer discussion, and that would be starting around the age of 45 for most people, or at the age of 40 to 45 if you're African American, or if you had first degree relative, which would be your father, with prostate cancer. Talk to your doctor about whether a PSA testing is right for you. Eye exam and hearing check. Changes can be gradual and easy to miss without professional evaluation. Skin checks, particularly if you've had sun exposures over the years, especially like people who've lived in Florida and had excessive or a lot of exposure under the sun, definitely important to get that done. In your 60s and beyond, the focus shifts more to try to stay ahead of age-related conditions, such as abdominal aortic aneurysm, which is a one-time ultrasound that's recommended for men 65 to 75 who have ever smoked. Lung cancer screening, which should be an annual low-dose CT scan if you're 50 and older and have a significant smoking history. Bone density screen, which is a test that's often overlooked in men, but osteoporosis is a real risk after the age of 65. Cognitive and mental health check-ins, also essentially checking for depression and cognitive decline. Those are also often underdiagnosed in older men, and it's worth discussing with your doctor. And vaccinations also matters at every age. The flu shot, COVID-19, pneumonia vaccination, shingles, and tetanus boosters should all be on your radar. Taking care of your health isn't a sign of weakness. It is one of the most important things you can do for yourself and for the people who count on you. If you're a man who has not had a checkup in a while, this is your reminder. We're here for you at Gowdy Family Care Center. If this video was helpful, please like, subscribe, or share it with a man in your life who needs to hear it. To schedule your physical or to schedule any of these screenings, you can visit us online at gowdyfamilycare.com or give us a call at 706-410-2684. I'll see you on the next one. And guys, make that appointment.